Welcome to part 6 of the COVID vaccine review. I am a member of the NHS team and I'm reviewing the COVID vaccine weekly. I have had the Pfizer vaccine 5 weeks ago. This short video is one of the most useful ones to watch in this series of the COVID vaccine review. I will update you on how I have been in the last 7 days in terms of side effects and complications. I will discuss the serious side effects of the 3 approved UK vaccines, which are the Pfizer, the Oxford AstraZeneca and the Moderna vaccine. I will also touch upon how the COVID vaccine is given. But most importantly, we will look at the risks involved in having and not having the COVID vaccine. So firstly, we will begin with how I've been over the last 7 days. I have had no side effects and no complications, which is great. So how is the COVID vaccine given? Now, I have touched upon this in my earlier videos in the series, so I'll give a short recap. So the COVID vaccine is given in the upper arm. A small amount of the vaccine is injected into the muscle in the upper arm. All 3 of these approved vaccines in the UK consist of 2 doses to be given between a few weeks to 12 weeks apart. Protection against the COVID-19 disease may not be effective until a week or more after having the vaccine. However, the first dose of the COVID-19 vaccine should give you good protection from coronavirus, but you need to have the 2 doses of the vaccine to give you longer lasting protection. Now we will go on to the serious side effects of the 3 approved UK vaccines. Please see the table in the image. I have outlined the serious side effects of the 3 approved UK vaccines. We have already had a look at the side effects of the Pfizer vaccine in detail, as that is the vaccine I had. So in this table you can see the serious side effects of the 3 approved vaccines. In general, we can note that all 3 vaccines can cause a severe allergic reaction. Anaphylaxis is a life-threatening event. As you can see in the picture, it can affect many organs of the human body. The signs and symptoms of the anaphylaxis include like the airway. You can experience coughing, shortness of breath, wheezing, chest pain or tightness, tightening of the throat, difficulty swallowing. In your brain, you could experience anxiety, confusion, headaches, feeling that something bad is about to happen. Heart-wise, you could be feeling faint, pale or blue colour, dizziness, weak pulse, shock, loss of consciousness. Stomach-wise, nausea, vomiting, diarrhea, stomach pain or cramps, skin, hives, swelling, itchiness, widespread redness, warmth. After having the COVID vaccine, please remain in the seated area for 10 to 15 minutes and longer if the medical staff ask you to, just so that they can monitor that you have not had a reaction to the COVID vaccine, as reactions occur in short time after having the vaccine. It is a treatable event, and if you have allergies, please do let the staff know before you have the vaccine. And people with severe allergies, please check before you go to the vaccine, because the vaccine may not be suitable for yourselves. And this very much depends on an individual's own reactions to medication. As mentioned in the last video, the Pfizer vaccine has rare side effects that can affect 1 in 1,000 people, which is the temporary one-sided facial drooping. It is not known whether this is actually related to the vaccine or not, but some people in the trial did get Bell's palsy. An accurate estimation cannot be available because of the data from the clinical trials. Going on to the Oxford AstraZeneca. So in the clinical trials, there were very rare reports of events associated with inflammation of the nervous system, which may cause numbness, pins and needles, and or loss of feeling. However, it is not confirmed whether these events were due to the vaccine. And finally, the Moderna. So again, this is rare, may affect up to 1 in 1,000 people. Again, it's the temporary one-sided facial drooping Bell's palsy. Also, swelling of the face. Swelling of the face may occur in patients who have had facial cosmetic injections. There is also a risk of severe allergic reactions, as previously. There is also a risk of hypersensitivity. So looking at all three vaccines overall, so there may be risk of a severe allergic reaction. There may be some nervous issues which may not even be related to the vaccine. Different vaccines are available in different areas, and all three have been approved to prevent serious COVID infections. So any of them are reliable. And don't worry about which one to have if you choose to have the vaccine. How it affects you may depend on a number of factors, which can include vaccine effectiveness, vulnerability such as being on immunosuppressants and having high risk treatments, body health, immunity levels, age, previous medical history, and so on. We can't be certain if we will get side effects, complications if any. It is a small risk we have to take against a risk of death. COVID disease, it's scary. Again, these risks are rare. So we now need to look at these risks balanced and compared against the risk of death. When balancing your risks of deadly disease and the side effects, I would like you to consider some key points, which are: firstly, that coronaviruses are not new. Coronaviruses are a group of viruses that cause respiratory tract infections which affect breathing. Now, these coronaviruses have been around since 1965. Secondly, people are getting COVID more than once. There are different variations which affect people differently. So there has been research since 1965 as well. So this vaccine just hasn't come out of nowhere within a few months' time. The research has been out there, started since 1965. Many threats in different coronaviruses have been happening since 1965. And scientists and other groups of people have been researching about coronaviruses, and everybody collectively has come together to give the nation a vaccine that will work, that is beneficial, protect us against this deadly disease. Also, I would like you to understand that many variations of coronavirus have come out since the pandemic. It's a constant look over the shoulder as to when the next variant is coming. And most of these vaccines that have been approved show a good efficiency against these new variants. I am here providing open, honest and transparent information. My aim is not to tell you what to decide. My aim is to provide information for you to make that informed decision. My aim is to give you more understanding so you can assess your own risk, assess those advantages and disadvantages, putting yourself centrally. If you're unsure or whether you're in the warnings and precautions group, check with your doctor. As long as your doctor has not told you specifically not to have the COVID vaccine, please assess your situation. I am sure most of you have had some sort of vaccine in the past. Ask yourself, have them vaccines been questioned like the COVID vaccine? Have them vaccines had such a conspiracy response? The answer is quite clear. It's no. So why generally is there hype and negativity about the COVID vaccine when lives are being put at risk? I want to end my video by sharing a COVID patient's story. This story is of Alexandra Adams, a fourth-year medical student, who has titled her story Life and Death. COVID patient in her 20s describes hell of life on coronavirus ward with gasping patients and crying nurses. The link will be in the description. Please do take your time to read this story. It is a real eye-opener. And lastly, I would like to say many hours go into each of my videos, and I would really appreciate if every one of you could be a part of my message and share it with friends, family and loved ones to give them vital awareness. By sharing these videos, it may help people weigh up their risks and help them with information they need to make a decision about the vaccine. Thanks for watching, and do subscribe to EvilBluur for the next podcasts and weekly updates. Thank you very much. Keep safe.